Hey everybody, welcome back to our ECG review of the day. My name is Reed. If you enjoy this content, please subscribe to my channel. Let's continue to review some EKGs together. So let's take a look at this rhythm here. This is just going to be a rhythm strip here. We're not going to look at the 12 lead EKG. This is an individual that we can just initially notice has a very bradycardic rhythm. If we see it's a narrow complex bradycardia, we've got a beat, beat, beat. And they're occurring very slowly. Our rate is somewhere, let's see, 300, 150, 100, 75, 60, 50, probably 38 or so beats per minute. So very bradycardic. And when we see a narrow complex bradycardia, we know that the narrow complex must be coming from the AV junction or above, because in order for that QRS to be narrow, that means we must be having good normal conduction through the His-Purkinje system. So this is something going on with AV node or higher. First thing that comes to my mind is this a sick sinus node? Is this a AV block? Right, those are big things that come to my mind. And what you'll see is when you look, I see I have a P wave in front of my QRSs. I see I have P waves marching through to my QRSs. And I see my P wave kind of has this normal bifid type notch here in lead 2. But I see an exact replica of that right here. I see it again right here after the T wave, and right here after the T wave. And that's just got that same exact morphology. And so, as I see, P waves are marching through, and my P waves, the rate of the P waves, if I mark this P wave, is 300, 150, 100, 75. It looks like it's around maybe 78 or so beats per minute. It's hard to say. Essentially, though, if you compare the atrial rate, so these are my P's, and this is my QRS rate, my P waves, there are 2 P waves for every 1 QRS. So it's 2 P waves for every 1 QRS. And so this is what appears to be a very high-grade AV block. What does that mean? So remember, first-degree AV blocks, every P conducts to a QRS. It just takes a longer time to do that, and so our PR interval is lengthened. In a third-degree AV block, none of the P waves conduct to a QRS. In this case, some of them do, so we can automatically know that this is a second-degree AV block, because we see that this P wave conducts to our QRS, this P wave conducts to a QRS, but these ones don't. These ones don't. These ones don't. And so we have some of them conduct, some of them are blocked. This is a second degree. Well, we know that in second degree, there's a couple different types. There's type 1, where we know the PR interval gets longer until it drops. There's a type 2, where the PR interval stays the same, and then it'll spontaneously drop. And then there's another one. This is on the kind of on the controversial side, high grade, which really is when we see a 2-to-1 block on or even a 3-to-1 block. Anything where you actually cannot even evaluate if this is a type 1 or a type 2, because in order to evaluate for type 1, we have to have several P's and QRS's in a row to determine if the PR interval is lengthening. To evaluate for a type 2, we have to have several P's and QRS's in a row to determine is the PR interval staying the same. So we can't determine if this is a type 1 or a type 2 second degree AV block, but we do know that this is a high degree block or a high grade block where we have 2-to-1 conduction in this case. And so my evaluation of this rhythm here is a sinus rhythm and a 2-to-1 high-grade AV block. So this person is definitely going to be a great candidate for a pacemaker, and I would imagine is going to do quite well. So I hope this helps you kind of work through AV blocks, and yeah, so have a great day.